Good afternoon. Welcome to Sharing Respite Experiences and Resources. Where do I start? Presented by the Ohio Caregiver Support Network. Handouts and resources for this webinar can be found at agrability.osu.edu. That's spelled agrability.osu.edu/caregiver-support-network. Once you're on the Caregiver Support Network page, look for the Caregiver Support Resources and Handouts. That's wrong. Stop. First, we have Karima Samadi. She is a public health professional with extensive experience in community health education. She earned her bachelor's degree in nutrition and food science from the University of Kentucky and worked in various programs ranging from child obesity prevention to agricultural education. Formerly an FNEP program assistant, and I'm going to let her tell you what that means. I kind of know, but not perfectly. She taught limited resource families how to eat healthy on a budget. And I will tell you, she is a phenomenal cook. If you're lucky enough to have Karima at your potluck, it's a good day. After earning her master's degree in public health from the Ohio State University, she leverages her public health research to influence policy, systems, and environment change through community-based participatory research. She was previously a research coordinator on the research projects Heal Maps, Healing Healthy Eating, Active Living, Mapping, Attributes Losing, Photographic Participatory Surveys, Voices for Food, and Prosper, a program that I also worked with her on, promoting school, community, university partnerships to enhance resilience. With her experience in research coordination, she's recently transitioned into a role as a food and agriculture knowledge integration specialist with the Knowledge Exchange here at Ohio State University's College of Food, Agriculture, and Environmental Sciences, and she's helping to deliver the broader impacts of research through integration and translation. Thank you. Welcome, Karima. Next, I'm going to introduce Whitney Taverna. I hope I said that right. I know I asked you, Whitney, but immediately forgot. She is a master's trained licensed independent social worker with expertise in the areas of nonprofits, senior services, ALS, and hospice and palliative care, and for 20 plus years has worked with clients living with cancer, dementia, ALS, Lou Gehrig's disease, and other life-limiting and chronic conditions. Her current roles include serving as a medical social worker for Ohio's Hospice of Dayton, as well as serving as care coordinator for the ALS Association's Central and Southern Ohio chapter, where she supports persons living with ALS, better known as Lou Gehrig's disease, in the Dayton regional area. She's been married for almost 23 years, has one 14-year-old daughter, a crazy mini Aussie, and also has just begun an informal role as support system and coordinator of care for her mother and father, who are living with her father's Alzheimer's disease and currently needing in-home respite as his Alzheimer's progresses. And our last panelist is Nate Kanban. I hope I said that right too. And he serves as the superintendent for the Tuscarawas County Board of Developmental Disabilities, where he has the opportunity to partner alongside individuals with developmental disabilities and community stakeholders to advocate for a more inclusive community. Nate previously served as the agency's transitional assistant superintendent and community relations special projects coordinator before commencing his career with the Tuscarawas County Board of Developmental Disabilities. Nate had the privilege of working directly with individuals with disabilities in various parts of Africa while serving as the project manager for a community development project which sought to increase inclusion efforts for individuals with disabilities. Nate holds BA degrees in International Studies and French from the University of Mount Union, along with a Master of Arts degree from the University of Pittsburgh in International Development. Thank you all. We have a very distinguished panel, and I appreciate all of you being here. I'm going to start by asking Karima, tell us a little bit about your caregiving experience, and that's it. Thank you.
Well, hi, everybody. Thanks for joining the conversation. I I'm honored to be asked to be part of this panel. As you could tell in my bio, it's not exactly part of my job, but it was quite a job, caregiving. So just a little bit about myself. I was a caregiver for my father for 10 years. He actually passed away just this past November. He had a rare stroke disorder called CADASIL. You probably haven't heard of it, but that affected his physical ability and cognitive function. So he developed vascular dementia, and a lot of sort of his lived experience was similar to folks who have MS. It's often misdiagnosed as MS. But of course, dementia, like Alzheimer's, has the cognitive barriers. So his condition was sort of going downhill over time. He went from using a cane to using a walker to in a wheelchair, and pretty much became total care the last 2 years of his life. So I did everything for him, fed him, bathed him, got him, managed his medicine. He also had difficulty swallowing, and later toward, the last 6 months of his life, he was on a feeding tube. So managing that. So yeah, some of these might be things that you all have experienced as well. But I was his primary caregiver. I'm blessed to have two amazing younger sisters. They're about a decade younger than me. I'm in my mid-30s, but who shared the burden internally. Maybe they weren't always tangibly able to provide hands-on care. Various times in my caregiving career, they lived with me and helped share that burden and did some of that hands-on help. And would step in for a respite for each other when we needed it. And I had some help from caregivers, paid caregivers, whether that was afforded through a grant or senior services, which is through, Council on Aging, Area Aging. Just to kind of briefly touch on family dynamics, because people always ask, like, what about your mom? My mother and father were still married, but their marriage sort of entered a rocky bout, right before he became disabled, when he had his first major stroke that disabled him. So my mom was there for us as daughters, as sisters, morally, and she is actually a physician, so she would kind of be there as a healthcare advocate, but didn't actually provide that caregiving. So and just sort of culturally, I always knew I'd be taking care of my parents. I come from a South Asian background. My mom is from India. My dad was from Afghanistan, so I'm a Halfgan, born in India, but grew up here in the States. Always knew I'd take care of my parents, being the eldest daughter, but didn't know it would come so soon. So I was 23 when my dad became disabled from his strokes, from his first major stroke that happened in his brainstem. So affected gait, and everything kind of from there. So yeah, I sort of navigated a lot of life in my 20s and 30s while being a caregiver, graduate school, my first career. I've actually been with Ohio State. Next month will be 9 years. So I will say Ohio State's been an excellent employer, very family friendly, and understanding through my caregiving career. I will say dating. I could write a chapter of a book on dating while caregiving. That was always an interesting experience. Met my now husband actually when I was a caregiver, and that's one of the things that made me want to marry him. When he loved my dad, I knew I loved him too. Purchasing my first home, retrofitting it for people with disabilities, folks who have someone in the home who's in a wheelchair, what that's like. Universal design isn't really as universal as we'd like it. And, as a millennial, I had a hard time navigating that caregiving experience, finding resources. It was like putting together a puzzle, signing up for Medicare was like, I have a graduate degree and, I consider myself health literate, but I will say that's probably the hardest thing I've ever had to do in my life is sign my dad up for Medicare. I'm sure you guys can relate to that too. And, you know, I'm a public health professional too. My mom is a doctor, but even then there were times we fell through the cracks on things. And, you know, it just always makes me think of folks who don't have advocates in their life or don't have the, you know, health literacy to navigate their own health or their loved one's health. You know, a range of experiences. I will always say caregiving was the honor of my life, and it is, caring for my father. But it was also the hardest thing I've ever had to do. Very isolating, socially isolating, a lonely experience can also often be lonely, which is why I'm glad to have networks like this. When the pandemic hit, you know, it was like, oh, socially isolate and, you know, don't see your friends. I was like, I don't do any of that anyway. So that part's easy, you know. Getting help in the home is difficult. So, you know, being able to work from home gave me the opportunity to do that. So yeah, that was just a little bit about myself. But yeah, I'm excited to hear and chat with you guys. So thank you.
Thanks, Karima. I think that is great that I also was my dad needed a caregiver the last year or so of his life, really longer than that. I called myself, my sister was the case manager and I was the assistant case manager. But it helps as a disability services professional. It's still astonishing what you don't know. So I don't know if that brings any of our participants or attendees any comfort that even people who are professionals in these fields struggle. I hope it doesn't discourage you, but boy, we sure appreciate it. Whitney, why don't you tell us about your caregiving experience?
Sure. Well, hello, everyone. As Karima mentioned, very appreciative of being a part of this panel. And the invitation came from a friend of one of my ALS clients. And so that's kind of how I got here, and one of my favorite ALS clients. So my start, just as far as a professional caregiver, actually family and professional caregiver, has been actually when I was in high school. I grew up, my family's from Dayton, grew up in Orlando. My dad was a football coach, and we moved down there when I was about 10 years old. Fast forward a little bit to when I was a junior in high school. My grandmother, very loved grandmother, ended up having a stroke, and we were in Florida at the time and came back up to Dayton. My mom was trying to help my grandfather to kind of make preparations because she was not responding in her state. And we had visited Hospice of Dayton at that time. And I was just amazed with the care and compassion that was provided to my grandmother. She ended up being in the hospital for most of her disease progression, and unfortunately lost her life after that stroke. And that profoundly affected me as a family member, as a granddaughter, daughter, and went through a lot after that. The next year, my dad had 2 massive heart attacks, and our lifestyle had changed quite a bit. And I became somewhat of a caregiver at that time, helping my mom with his care and getting him kind of nursed back to health. So my hospice, experience started there, and I always knew I wanted to work in the hospice and palliative field. I actually, like Karima, graduated from UK with my master's in social work, but prior to that had a similar background. My undergrad was in health education down at Eastern Kentucky University, and my first job out of undergrad was working with the ALS Association in Kentucky. Was the first hired staff down there. I got to do really cool things like start all of their programs, and got to find my love, which is working with individuals with Lou Gehrig's disease. And for many who do not know what that disease is, it's a very progressive, fatal illness. Can affect a person's ability to walk, talk, breathe, And so essentially the muscles are weakening over time, and individuals become paralyzed. Most of them do not have any cognitive impairment, which makes the disease even worse because they're kind of trapped in their own body. And so kind of coming forward to what we're talking about today with respite and caregivers and the needs that you have, our caregivers definitely need respite. They provide 24/7 care, and there are certainly lots of needs there. So um, moved on from the ALS Association after I started graduate school. We ended up somehow coming back to Dayton. My husband got a job here, and then I finished school. We had my daughter Sophia in the meantime, and so we planted back here in Dayton. And then I've worked with the Alzheimer's Association, so learned a lot there, worked with a lot of caregivers there, and advocacy, and helping individuals with understanding the disease, which I think as caregivers is one of the things that is very helpful as you have a diagnosis, whatever it may be, is just, kind of learning more about that disease, understanding it, so kind of what you're facing, and, you can kind of make a plan with your family or your private caregivers. And then kind of hopped back into the hospice world. And so on the hospice end of things and palliative care, we have a lot of discussions with patients and their family members about, long-term planning, and, what are their wishes as it relates to their illness and the progression of that. And then a lot of what I see as a social worker is, the need that caregivers have, the extensive care that they're providing to their loved one, and how it affects them. I think one of the things that we don't often talk about is the grief and the loss that comes along with a difficult disease for the patient, of course, and for the family members. And a lot of what I do with the ALS Association now is I work, directly with our patients and families to understand their illness, to get them connected with equipment they need to, try to help them process the losses, because the losses can be each week for many of them, and the same with my hospice clients as well. So again, I hope that answers your question and gives you a little bit of background about me, and just happy to be here. So I appreciate it.
Whitney, thank you very much. Nate, can you give us an introduction to yourself and a little bit about what you do?
Yeah, good afternoon, everyone. My name is Nate Kanban. I'm very happy to be here with all of you today. I've already been so impressed and encouraged by the stories that I've heard from both Karima and Whitney. So a little bit about me and my caregiving experience. As was shared earlier in my biography, I began my work with people with disabilities in sub-Saharan Africa. It really just ignited this passion within me to work with people with disabilities. It was incredible seeing the way in which their families with limited resources stepped up to care for their loved ones. And it created this passion to work with this population. During that time, my wife and I had several children and realized that working abroad was a bit of a challenge. And so we began a transition back to our hometown of New Philadelphia here in Tuscarawas County about 5 years ago. And so I stepped into the county board as a public relations official, and then within a year or two was able to move up to the superintendent position. And one of the first things that really struck me when I stepped into this role was the real lack of coordinated services for some of our individuals with the most challenging needs. And one instance really just was monumental for me. We were meeting with a young man and his family. He was about 15. He had significant developmental disabilities, health issues, and mental health diagnoses. And unfortunately, the family had worked to support this young man for many years, and his needs were beyond what they were able to take care of in their home environment. It was becoming dangerous for this young man, his siblings, and his parents. And while I watched the different service entities come together, there was Jobs and Family Services, Mental Health, Board of DD, Family Children First Council. Unfortunately, it became very clear that the issue at hand was about who was paying for what, and almost a fight over which diagnosis was the most significant, whether it was MH at 51%, DD at 50%. And in that moment, I saw this family come to the professionals in their moment of deepest crisis, and it becoming an issue of who's paying for what and which diagnosis is more severe. And that struck me. Eventually, we were able to figure out the payment. But then what happened was, in order to find the necessary care for this young man, there was nothing in our vicinity. We ended up finding a provider in northern Kentucky about 4.5 hours away. And so I thought about this family who had just gone through this traumatic event, had their child removed from their custody, and now was living 4.5 hours away. Just driving to see their child on the weekend would be unsustainable, thinking 9 hours in the car. And so that really made us think here locally in Tuscarawas County, this change of belief that these children, that's kind of been our focus, are our kids, regardless if they're mental health, JFS, DD, these are our kids. And in this community, even though it's not huge, we deserve to have excellent services for kids who should be able to be served here in this community. So families no longer have to think about providers 4 to 5 hours away, sometimes out of state. And so that really started this ideological shift in our community of how we serve kids and the services that we want to provide. And so we reached out to the Department of Disabilities, DODD. They provided us with 2 grants to develop respite programs here in our community. And it's been a godsend. I feel like one of the worst positions to be in as a human service professional is when somebody comes to you in crisis and you have no options, or the only option is a provider 6 hours away. So we've developed an in-home respite program for a family who's maybe struggling to care for their child with intensive needs. We have trained staff who are registered behavior technicians who work in the home to provide positive behavior supports, parent mentoring, things along those lines to help support the child in their environment, in their family unit. If the need surpasses what can be done in the home, we have developed a 60-day out-of-home respite program that focuses on a therapeutic approach, looking at behaviors, ways that we can help the child return back to the family. But while the child's in our care, we're also working with the family, providing ongoing mental health assistance, parent mentoring, parent coaching, to see what can be done to strengthen the family to allow that child to be able to rejoin that home. But what I've really found in kind of the bottom line is just the importance of respite. Raising a typical child is challenging at times, but when you have a child with intensive needs, it's very difficult and very isolating. I've heard from several of our families that eventually their friends stop calling because it's just too difficult to socialize with their child. It's a difficult place to be. But just periodic respite we found has been able to keep that family unit intact. And that's been so encouraging to see, and to have options here in a mid-size, largely rural county, not having to look at options in Columbus, Cleveland, Cincinnati, is really life-changing for our families. So that's been a bit of my experience with respite and seeing how it changes family dynamics and gives families hope. So thanks, guys, for allowing me to be here today. I appreciate it.
Nate, thank you so much. You brought up a lot of great points about how frustrating it is when somebody needs something, you know exactly what they need, but you can't give it. I think most of us have had that. I'm going to put up a poll. I want to know who we have here. We had a couple questions in chat of who's here. And I know we've got professionals. That's supposed to say client, the last word, professional caregiver. I should have actually put one in for just service provider other than caregivers, which I would fall under. We've got a good balance of people going on here. It's going up. Okay, but thank you again. We've got some really, really good questions, and I'm going to give the panelists something to think about question-wise. First of all, when there is a lack of coordinated services, what is the first step? So while you're mulling that over, solving the mystery of the ages. I am going to continue, give a couple more minutes on another couple more seconds on this poll, and then I'll share it, and then let's go off to that. What's the first step? Okay, let me share the results. So it looks like we have a pretty good mix between child and spouse caregivers, professional caregivers, and then caring for a parent is by far the largest, 40%. Yep, been there. It's very rewarding, Karima, like you said, but boy, some days it's frustrating. It's hard to be their parent sometimes. So panelists, you're gonna solve every problem for us. What is the first step?
Karima, okay. Well, I guess coming from my background and just kind of looking at my dad, who is, you know, in probably mid-stage Alzheimer's, I think the first thing is education, you know, just educating yourself about the illness, the disability, you know, whatever it is that you're facing. You know, I reach out a lot to the Alzheimer's Association just as a professional, as well as a family member now. I've been on some of their educational webinars. You know, there are certainly support groups, you know, so I think education is a good first step. You know, reaching out to those nonprofits that maybe have resources that you aren't aware of. You know, respite is a hard thing to find. It's, you know, and those are the professionals that, you know, can kind of help, you know, help you get connected in the community. So that's kind of what I think.
Yeah, I think that's huge. Educating yourself on everything possible at all. Even just calling organizations and saying, like, what services do you provide? Because you might not even know you need something until someone says that. Like, I didn't know what the word respite was or what it meant until my father was on hospice and I was afforded that opportunity. And I would say social workers, whether they're through the hospital, through your whatever provider, if you can just get in touch with a social worker, they are your networking wizards. If care cannot be coordinated in any other way, the social worker is your saving grace. They will often know how to pull those strings, know the language, know the insurance, and they work magics. I mean, they are magical and can work wonders in terms of helping you navigate that. Because as you know, the someone alluded to in chat, it's just so disconnected, and getting those pieces to connect together, filling those gaps is one of the hardest parts of being a caregiver.
Yeah, and if I could add a little bit as well, my experience being more in the realm of kids and teenagers is we really rely heavily on family and children first councils in Ohio. Each county has one of these councils. It was developed, I believe, in the mid 90s. And what it does is it coordinates services for kids who are involved in multiple service systems. We really see it as a godsend when we have kids who are involved in different systems based on different diagnoses or issues that they're facing. FCFC is kind of like our quarterback. They really help to bring everybody together to one meeting to plan through what needs to happen to serve that child. So from our experience, that's one centralized coordinating entity has been hugely helpful.
You guys, that was awesomely helpful. Thank you. We have so many good questions coming in. I'm trying to think of what the next one to say. One question is pretty specific about Alzheimer's, but I feel like it could be broader. What advice would you give for caregivers who are looking for respite support, healthcare supports for someone with Alzheimer's, and I'll say with any kind of a condition that needs a caregiver, especially when they may be too financially sound to receive financial support from the Area Agency on Aging? So how do you find caregivers, especially if you were rural? I imagine, Karima, it was probably even challenging in Columbus to really sort through, but how do you, Nate, you're rural. Whitney, you're not Columbus, but you're not rural either. You're still in a big size city. So what do you guys suggest for finding? I know the Area Agency on Aging is always a great place to start. Is it is it better if you can pay for it yourself? Does that, I mean, it seems like it would broaden your options, but is it too many options?
Yeah, I think a lot of times I refer, of course, to the Area Agency on Aging. There's also a lot of, especially if you're in a rural area, looking at like the senior centers, even if it is a person that's under the age of 60, sometimes they have list of caregivers that would maybe be less than paying for a private agency. The private agencies are, they can run from $22 to $25 an hour. So that gets to be a pretty hefty chunk of change for people. So definitely reaching out like to the senior centers, Catholic Social Services, at least in the Dayton area in Montgomery County, does provide a respite program. They can't do a lot of hands-on care, but I have a lot of folks with dementia that I've referred to them for 4 hours a week of respite care. So definitely utilizing some of the senior centers and things like that. Sometimes they'll have a good running list of people in the community, especially if it's a small community, that they can tap into.
Mm-hmm. And someone in the chat box mentioned Franklin County. If you're in the Columbus area, Franklin County Senior Options, we really benefited from them, not only for respite, so having 13.5 hours paid for through a grant for someone to come and help us in the home, but also incontinence supplies. So they're a great, and again, kind of through Area on Aging. Yeah, and thanks, Tom. I was going to say Alzheimer's Association. A lot of times they'll have a list of either private duty or public agencies that provide caregiving. Honestly, I've gone to care.com a few times, and there's folks there. A lot of people who work in home health care kind of have a side hustle on care.com, and was able to find some great folks there too.
Is the senior options, that's not just Columbus, is that Ohio or is that national? Do we know? Or is it, maybe it is just Franklin, but I felt like I had heard it in a broader sense. Whitney, do you guys?
Yeah, I think they pool together money. I don't know if you know, Whitney, from like different buckets. So some of it's COAA, Council on Area Aging. Some of it's like state, federal dollars. So they kind of like, and so there might be something like that in your municipality, but your Area on Aging would know.
Thank you. And one of the handouts that I'm going to send out, the handout I'm going to send to you, I'm going to send you to the Ohio Agribility website, first of all, because that's where I work, but we have a caregiver support page. I have listed every one of the Ohio Area Agency on Agings and that listed by county. And then the handout that I'm going to send you, there's an 800 number. So that if you don't have great internet access, there's an 800 number you can call and say, I'm in Henry County, and they can direct you to that Area Agency on Aging. So a couple days to get everything edited and put together, and it'll go out to you.
And I just wanted to mention, Kathy put in the chat box, which good point, Kathy, with the Area Agency on Aging, don't be fearful of reaching out to them because you think that you're over income, because in each county, like here in Montgomery County, again, we have not just passport/Medicaid where you have to, be low income, but we also have the senior levy program. So that is for people that maybe are above, the Medicaid threshold. And then sometimes, depending on the county, I know in Greene County, sometimes they will, even if you're over income for passport, you can pay a lesser fee for care. They would just use an agency, and then you would just pay however much, for care, but it would be a lot less than the $22 to $25 an hour. So.
And Laura, I can maybe speak to a little bit again from the kids' side on this issue. We found it to be a real challenge sometimes with families who maybe do not qualify for Medicaid to pay for respite. There's been a terrible practice in Ohio for many, many years where families, when they're not able to pay for the needed services for their child, they actually have to relinquish custody to their local jobs and family services. Something that happens all too often throughout the state. hearing from one father recently who had to relinquish custody to get the type of respite care they needed, then went to their child's IEP meeting and was unable to sign the IEP document because they were no longer the legal guardian of their child. If you can imagine how heart-wrenching and gut-wrenching that would be. However, just recently with the DeWine administration, there's been a real push to redesign how this is done. There's a very ambitious program underway at the Department of Medicaid now called Ohio Rise. It stands for Resilience Through Integrated Systems and Excellence. And what this does is it'll be investing heavily through managed care plans to develop local respite options in-home and out of home for kids with intensive needs, and providing ways of expanding Medicaid so that in order to access these services, families are able to use traditional Medicaid instead of relinquishing custody of their child to Jobs and Family Services. And this program is on a work group right now. There's some committees working through it, but the implementation date is early January of 2022. So this is a fast-moving, significant development to Ohio's system of care. But I'm very excited, and I think it will change the way in which some of our families work through respite and getting necessary services.
So a question I've seen in a couple different versions are, how do we find a qualified person willing to work with our son? John says that his son has ASD, which I assume is autism spectrum disorder. Hopefully I'm not wrong on that. So how do you find someone? And then another question someone had was, how do you check the references? You're inviting a total stranger into the home of this is me editorializing. You're inviting a total stranger into the home of your vulnerable loved one. We had a house, we were supposed to have someone that came to my dad's apartment and did housekeeping, and he couldn't remember if she'd been there or not. We got charged for it. We never knew if she was actually there, but how do you know? And then I'm going to add into that, we have one, what do you do about like during COVID? We had someone that I think they said their parent had gotten vaccinated. So maybe they're a little bit lower risk, but how do we find people? How do we vet them? And how do we make sure this person should be alone with our vulnerable loved one? Lots of questions.
Well, I will say from experience, don't get too attached to one caregiver. It's often a revolving door. That's just the nature of the industry. So just be prepared to be flexible and, have your list of must-haves, but also have your want-haves, would like to haves, prioritize what's important. My dad luckily was a really easygoing guy and liked everybody, and didn't really care for male caregivers. So that was really my only, screening or criteria, must have a woman. But I am going to put in the chat box this list of kind of interview questions. You can find a lot of these on different websites, but just kind of getting to know the person. Think of having like a training period. A lot of times folks will talk about their experience. They'll say whether they've worked in a memory care unit. It's always helpful because then they know how to interact with folks who have cognitive disorders. So finding out, have they worked with someone who has autism? Have they handled the equipment? Do you have a Hoyer lift in your home? Are they on a feeding tube? Do you some of those medical needs, you'll need to ask. So kind of make a list of what is what you need for your loved one. And what helped me is just going through their day, because we were very schedule oriented. So I would kind of go through that with the caregiver. We'd have a training sort of probation period, let them know, we're not sure if this is going to work, but here, I'm going to work from home this day, if possible, and I'll kind of train you. And sometimes it worked out, sometimes didn't. Our longest caregiver we had for 2.5 years. And we were so sad to see her go. She moved on and went back to school and got another job. But just kind of flexibility is the key word there. But also don't compromise on things that are important to you. If you really cannot have a smoker in the house, make sure you ask that in the screening process, and care.com and websites like that, if you do go the public route, you know, you can create your profile and have your criteria, and those folks will message you. And again, it's like dating is how I looked at it. You know, it's sort of like you're dating and you're just trying to find someone that's the right fit for you and your loved one.
And Laura, speaking to the question about a child with autism and seeking respite care, my first step would be to inquire at the local County Board of Developmental Disabilities to see what providers and respite care is available in the county. But I wouldn't stop there, because there are many counties, much like how Tuscarawas used to be, where we didn't have somebody. So then we would have to expand outside of our county. I would encourage people to ask if they're in the DD system, their SSA, Service and Support Administrator, kind of our terminology for caseworkers, to expand the search beyond the county that they live. We have many providers in this state who work in multiple counties who might be able to pull staff from a larger county down to a smaller county. It's something that we utilized in the past, being next to Canton, Akron, pulling staff down from those communities. If there's nothing that they're able to find through that, I would then recommend reaching out to the Ohio Provider Resource Association. They're the advocacy group for providers in the DD system, and they could maybe do a search as well, looking into some providers who could be of assistance in serving kids with intensive needs.
I was just going to add, just as far as, again, kind of looking at the illness or disability. I know here with the ALS Association, we keep a list of caregivers who have actually been either a personal caregiver, you know, maybe their spouse had ALS, or a professional caregiver. So kind of the same thing along the lines of the, you know, senior centers and things like that. Sometimes, like was mentioned by, I think Karima mentioned the Alzheimer's Association. A lot of times they'll have a professional caregiver list, which many times can be family members that have had a loved one that can provide the care. So.
So we had a question in chat, wondering if Nathan might have a particular insight about this. How does one support an adult with special needs who themselves is a caregiver? My brother is highly functional autistic and taking care of my mom in another state. We've been able to be a team. He handles driving, cooking. I handle advocacy and finances, but how can I better support him? And I will say, that's incredible. And my dog is barking, so I'm going to go mute now. But Nathan, what do you think?
Wow, that's an excellent question, and kudos to that man who's providing this excellent service. I mean, my first thoughts, if the individual is in Ohio, is again to reach out to their local county board system to see what type of advocacy groups are in that county. Each county board is charged with having an advocacy group where you focus on things like self-advocacy, how to advocate for yourself, making sure that you're getting self-care. And then beyond that, I would then look at some of the social networks that are provided by county boards in each community. I've seen very integrated or very innovative things happening at the county boards to keep people with disabilities involved in their communities during this time of COVID. We have several movie nights, Zoom activities all the time to provide opportunities for people to socialize. And just like for you and I, for someone with a disability, that is an important outlet to be able to maintain self-care. So that would be my starting point, was looking at their local system of care, their county board, to see what opportunities are available to support the individual to allow them to be successful. And then something else that we focused on here as we've developed respite programs and support to our respite providers is really focusing on trauma-informed care. It's really provided a whole new way that we look at respite and understanding the trauma that many of the folks that we serve, they're faced with in becoming a caregiver, or the individuals that we serve, some of the behaviors that we see from them, understanding that it's not just a discipline issue, it's a result of some of the trauma that they faced in their own lives. And we've seen some ways that this trauma-informed care training has been tailored to people with disabilities specifically. And it just provides a whole new compassionate level and deeper understanding of what it means to be a respite provider. And one of the most excellent resources for this is here in Ohio. Her name is Sarah Buffy. She's a trauma-informed care trainer from the Cincinnati area, does many trainings that can be accessed online, great videos on her website. It's Soulbird Consulting, but we've always found that to be a good support and and a morale booster for our team.
Thank you very much, Nate. I'm going to put a quick pause right here. Dr. Karen Moss has joined us. She was going to give a very quick overview of 2 different research studies that is seeking participants right now. And then we're going to come back to this phenomenal conversation. But Karen, are you all ready?
I am ready. Good
Thank
afternoon,
you.
everyone. And thank you so much for allowing me to share this information with your audience. Once again, I am going to share my slide or my screen, sorry. And what you should be able to see is the first research study flyer. So I am Dr. Karen Moss, pictured at the bottom in the tiny picture here, an assistant professor in our College of Nursing at The Ohio State. And I just appreciate the ability to share several research opportunities that we have going on. The first one that you see here is seeking specifically African-American or Black dementia family caregivers, and any type of dementia is what we're seeking. So those who are currently caring for a loved one or was caring in the past, so former caregivers as well. We're basically asking in an interview that is now over the phone because of COVID, asking questions about healthcare decision making. So, you know, I appreciated is it Whitney's presentation earlier, speaking about, you know, hospice and planning for, you know, the end of life, which is a very much an important part of life, right? And so we are just trying to figure out how we can do a better job as healthcare providers with assisting these individuals in particular with healthcare decision making. And so we're looking for current and former caregivers who fit this category. In addition, it's not on the flyer, but we are also interviewing healthcare providers, and those healthcare providers do not have to be Black or African American. They just have to interact with these individuals in a professional way. And those would be nurses, physicians, social workers, community health workers, and the like. And we're also seeking community stakeholders. So for this group, we are seeking those such as pastors of churches, heads of Alzheimer's associations, and other civic groups who also interact with these groups of individuals, either the individual with Alzheimer's with dementia or their caregivers, to ask them about their perspectives as well on how we can do a better job serving these groups of individuals. And so that's one study. This one is a group of studies, and I'll ask that for any of these that folks may be interested or think they may qualify for, that you reach out to the contacts that are on the flyers, and the packets that you will receive at the end of the conference will include the study flyers, so you'll have the contact information for who to reach out to. So this particular study has kind of 3 different arms or versions, but we're trying to figure out how we can do a better job of assessing, managing, identifying, pain, particularly in folks with Alzheimer's disease specifically, and also those without. So we're also looking for older adults who are in the same age brackets to be healthy controls. So if you think, and particularly as caregivers, you can potentially be a healthy control. So please do reach out to us and we can answer specific questions about whether or not you and or your loved one would meet the criteria for these studies. A lot of the caregiving studies, we pair the person with dementia along with the caregiver. The first slide that I showed you, the first flyer, that one is just, the interview is just with the caregiver. And so I appreciate the ability to share these with you. Like I mentioned before, you'll be getting copies of these with the contact information for each of the study's main contacts. So please don't hesitate to reach out, and we are happy to answer your questions. Thank you so much. I appreciate the opportunity to share.
Thank you, Karen. I will be sending those flyers out. I'm not able to post them on the website because of the research agreement that the studies have with OSU. But when I send out the resource handout tomorrow or Friday, I'm going to be realistic with the recordings, I will send both of those flyers, and you can contact either Dr. Moss or Mr. Iverson about those studies. Thank you, Karen. And I encourage people to look into those to learn unless we do a study. So I think it's a These look like good studies to be part of. So thank you for that commercial. I wanted to give the panelists a chance to catch their breath. We're coming up on 3, but anybody that has to leave, please, obviously I can't stop you, but if you don't mind going on for a little bit, panelists, we have a lot of great questions and I don't want to cut people off just yet. Thank you. Karima, I know you and I are always ready to keep talking. We're not going to stay till 6, but we might stay a little bit longer. Several questions have come up about COVID, and people are now getting vaccinated. Some people are on their 2nd vaccine. Some people have not gotten one yet. And obviously, many of our care recipients are already vulnerable or fragile. So there's really a big risk with that. Tom Hess, our supervisor from Department of Developmental Disability, said it's vital to keep using the most recent Department of Health and CDC information regarding safety and masking and social distancing and cleaning. And people are really, really trying because the providers don't want to get sick any more than they want to get someone else sick. So there's there. In the resource handout, I think I've got some COVID-based resources, but has anybody got any experience of having someone in during this pandemic, having an outsider into your home or your, and how is that, how has it worked? What's it been like?
We did early pandemic, you know, how it's kind of broken up into phases. So in March, and early April, we had a caregiver, but when our office, you know, and OSU went completely remote, I kind of made the decision to mitigate the risk of virus transmission at that time. And my sister moved up from Cincinnati to live with me. So we kind of stepped in and assumed that role. So we were on the clock 24/7, but, you know, and then my other sister was already in the home too. So with the 3 of us, we were able to manage. Again, that's not the case for everybody, but if you don't feel comfortable having a caregiver in your home, I will say that even home health caregivers have to follow all the requirements. Sometimes they get tested on a routine basis through their agency, but they have to wear masks and things like that. But obviously, you know, some of these tasks as a caregiver, you can't do 6 feet apart. You know, you're all up in someone's face and all the time. And so, you know, it's just a decision you'll have to make for yourself. But if you are during this time wary of hiring outside help and you're able to form a bubble with family or friends and lean on each other for support, that might be a route to go. You know, again, everyone's situation is different, but that's just my experience.
I know at hospice, just as far as staffing, you know, we do have regular tests that we kind of keep our tests with us each week. And, you know, certainly for our nurses and our personal care specialists that provide the most direct care, you know, they are testing pretty frequently. I know for my parents, you know, just living with Alzheimer's, you know, they're definitely staying in their bubble, as Karima mentioned, and we've encouraged, you know, kind of social distancing with them until they get their vaccines. So it's definitely a challenge. I don't know that any of us have a good answer other than, you know, go with your comfort level for sure.
And something I can share from the DD system that has just been phenomenal to see is the state has really focused on individuals with disabilities with diagnoses that would make them most susceptible to the worst effects of COVID. They've been prioritized in phase 1A and phase 1B of the vaccination process. And that's been done on a very county specific level. So some of the individuals with disabilities who have the most intensive needs should have been able to receive a chance to get their vaccine, which has been really phenomenal. I believe Ohio was one of the only states that prioritized people with disabilities at such an early stage, which is incredible. But a resource that we've relied on a lot with families is from the Department of Disabilities. A physician who works there, Dr. Laura Sorg, did a webinar on the vaccine and discusses COVID in general. And she does it in a way that regardless of your functioning level, you can walk away from those webinars understanding the benefits, the science, the data behind these suggestions, the vaccine. And that's been really well received by our families locally as they've been weighing their options.
We had a question about using faith-based initiatives, so churches and other faith-based. And Tom Hess had shared a link to the governor's faith-based initiative. I will put this link into this ever-lengthening handout, resource handout, but this is phenomenal, all these things that are coming up. He believes that it's typically a direct referral would be a very local decision based on availability in the community. So some churches, the church that I attend, Central College Presbyterian, is a large church. They have a big outreach ministry, but I know some other churches are a lot smaller. But yeah, that's definitely something to look at. And then I saw another question about caregivers and self-care and mental health. I had put a link in, and I will share, this is already on the handout. We have a county by county for Ohio. I apologize for those outside Ohio, but we have a county by county resource list for mental health, for, I think there might be some food pantries, a lot of different public services and a different opportunities for service and health in each of the 88 counties in Ohio. I would also say one thing that this pandemic has taught us is that telehealth is a very realistic option for many of us. Teresa Young, she was our speaker this morning. I know she's done a lot. I think she has really gotten a lot of work with doing telehealth. So it's probably a lot like, it's a more secure platform than we're on now, but you can either talk to a counselor over the phone or have a face-to-face video conference like this. And it's not quite the same as being there, but it's a lot better than nothing else. And I think if you live in an area that doesn't have a lot of mental health resources, it's fantastic. I live in Columbus or New Albany, it's a suburb. There's therapists and counselors everywhere. However, if you live in a place that doesn't really have them, I would really look at telehealth. And this is something that I would suggest when we send out the resource, look for the county mental health resource page and contact your county alcohol, drugs, and mental health board or NAMI, National Alliance on Mental Illness. They would all have suggestions and resources for providers that could do telehealth and other things. Wow. Okay.
Laura,
Yes.
this is Whitney. I just wanted to mention something else I saw in the chat. Somebody had mentioned it's difficult to get to support group.
Yes.
Which I'm sure we all can understand that with being caregivers. I did want to mention, I know just through the ALS Association and through the Alzheimer's Association, a lot of times what they can do is set you up with a peer caregiver, either someone who has been through the journey or is going through the journey, just someone that you can talk to when it's convenient for you. So I would definitely, again, I can't say enough, reach out to those nonprofit organizations because they have invaluable resources, for that support. And then the other thing along the lines of mental health, working in hospice, we have wonderful grief counselors, and they are here a lot of times through hospice. Most hospices do provide some type of grief counseling, and some of them will offer that resource to the community. So you don't have to have a hospice connection for that. Our hospice here in Dayton and many for-profit hospices provide it too. We do provide that type of, grief counseling to anyone who's experienced loss in our community. So again, you don't have to have a hospice connection for many of the grief counseling services. And, the grief process, it's about, all the losses that you're going through right now, no matter, what the disease you're facing, what disability you're facing. So can't say enough good about that as a resource too.
Yeah, and a couple of resources I found really helpful because we mentioned how caregiving can be a lonely space, but the Caregiver Space is a national network. I think it's a nonprofit as well. I put the link in the chat box, but they have a pen pal program, which is kind of old school, but just sending emails back and forth to people. It's a little bit more of an intimate setting where you can just share about what's going on with you, form connections and friendships with people. I'll share another link that's this is like a massive Facebook group with like 17,000 members on it. I've been a member of this group for 5 or 6 years now. I will give you a disclaimer, it is a venting space. And so you will see people go in there and you'll see caregiver burnout on display multiple times a day. I mean, with 17,000 members, you're getting lots of posts and updates, but if you ever posted anything or felt comfortable to, you will get 75 responses on tips. So if it's like, what, is a good cream to use for, incontinence, you'll get so many tips. So that's, a national network. I think it's actually international, but a nice place to go and feeling alone. I know Tom here, Tom Hess is creating a Loop Ohio group. So that's more state specific. And that's going to be a little bit more protected in that you'll have to create an account. I mean, the caregiver support group that's on Facebook is a private group, but it's massive. So one that's more specific to our geographical place would be the Loop Ohio one, but just, I'll let him share the link to that, but just wanted to share these two as things that helped me out.
I'm just going to put in another resource, Lots of Helping Hands, which is another just idea to kind of gather your care connection group, essentially. So I'll put that in the chat.
And I can share as well, in our county, something that we tried is we identified 5 or 6 families who've been further along in the DD system, who have adult children now, and they agreed to just be mentors for families, because for some of our families, it's overwhelming to navigate the various service systems. When do you apply for a Medicaid waiver? When do you not? When do you disenroll? All of those types of things are overwhelming. And when we looked at families who have kids who are involved in multiple systems, I think we counted at one point they could have up to 5 different caseworkers, 3 to 4 different budgets that they're working with each agency. And the mere thought of that is overwhelming. And I think I struggle with keeping my kids' soccer schedule straight. If I had to work through all those different systems, how challenging would that be? So what we've tried now is identifying those families who've gone through this, who are further ahead, who can speak to the new families just entering. And I can share that flyer as well.
Thank you. I'm going to circle back to what Jody said. Lots of Helping Hands makes me think of 211, which you can call from anywhere in the country. And 211 will connect you. It used to be called First Link Ohio. Now it's Hands on Ohio, Helping Hands Ohio, something like that. But you call 211 and you can say, I need to find a food pantry. I need a dentist appointment. I need respite. They know everything. They're a phenomenal resource. 211 is all you have to call, and that should work everywhere in the country, I believe. And Cynthia, you did in the chat, I'm going to take all these. Fortunately, Zoom saves the entire chat. So I'm going to go back through and I'm going to pull out all the links that have been shared in here. I'm hoping it saves the Q&A. I may just go through that and copy it before I close the Zoom down today. But I am going to save all these links and it's going to get sent out to you in the next couple of days. Let's say Monday at the very latest, but I'm hoping by Friday I can have everything sent out. So thank you. And then Rhonda also said, if your county has system of care for youth, to check your local mental health boards. I work under the system of care grant for our county, and it's great. I also lead a parent and caregiver support group that's all virtual right now. So I got to say one thing. I mean, it's great. I think that we probably were able to have more people here today because we're doing it via Zoom. Nobody's driving. We're recording it. There's a lot of drawbacks to this, but there's also, I think, a lot of positives. So I prefer to look at the positive. Like I didn't have to drive in the snow once this week, and that has been a treat. I will say that. And then Sarah said she's looking to start a respite program through her local church. Tom is one of our panelists today. He had provided a link to the governor's initiative. So I will share it back around to you, Sarah. And I would check back into that because maybe, Tom, I've never looked at that link. Is it a listing? Like if she did get a respite program started at her church, could she then put it on the list so that other people would Does it work like that? It should.
Not really. It's really an opportunity for funding and support. I know once you get into the details of the faith-based initiative, there's a lot more opportunity for that kind of engagement around the state, but it's a good start around the conversation and funding. And I also think it's really good to know that the governor has such a thing, right? I think we live in a place where there is a faith-based community, and the governor acknowledges that and supports it. And I think that's really a great thing.
Yeah, just to echo that, often it takes a community, respite, a lot of times we talk about resiliency and that's all on the individual, right? Or the household. But in order to self-care, which is, the definition of respite, we need a community of care. And often that is your faith-based community, that is your neighbor, that is, an online group or an organization. And so find your community, that's really what's going to help you get through this.
I think one thing, Karima, you had already mentioned Loop, Ohio, and I was going to ask Tom to come on and give a little commercial to it. But I do not really love Facebook, but I certainly appreciate it for the power it has and what it does. But again, it's a free for all. So it can be mean sometimes, and nobody who's a caregiver needs to have anybody be mean to them, even somebody who thinks they're well-meaning. Loop is going to be a lot more tightly regulated. And Tom, could you give us a little about the caregiver group that we just formed, and also about some of the other benefit pages and things that might be helpful?
Absolutely. I think Loop Ohio has been around for a couple of years now. It's Ohio's community of practice around essentially working with people with disabilities. We've been kind of signing up people for Loop Ohio for a couple of years. There's about 4,700 members right now across the state of Ohio, and it's free. And the idea is that we start conversations around things that are of issue: respite, transportation, caregiving, behavior, autism. There's about 50 different topics that are discussed in there, all around caregiving and support. Those conversations are mentored. So we have someone who is qualified and vetted through the department to mentor these conversations so that they're heading in the right direction. So you're not getting bad advice on a Facebook page, like was mentioned. Not that they're all bad, you could get some good advice, but this we make sure that it's mentored and directed, and we pay attention to who's in there. I use as an example, I work with a group of certified benefits analysis professionals, and there's about 150 of them across the state of Ohio. And I use Loop Ohio to communicate with them. And I say Frank, I'm not a certified work incentive planner. They have conversations going on about Social Security work incentives and past plans and 1619B, and really in-depth conversations that require a professional and a mentor. And they've got 50 conversations going on at any one time to help people stay in communication and get those answers that they need. And it's really just a wonderful tool. One of the things I really like about it is, if you're not one that chimes into Facebook pages or likes to put your word out there, you just want to lurk and see the conversations that are going on and stay private, you can do that in this group. You don't have to chime in. You don't have to be out front being the one putting your name on things, but you can have access to all that great information. And I know a lot of people do that. So it's certainly a wonderful tool. Go on loopohio.org and sign up and take a peek. We're running this Caregiver Support Network group. Once you register, if you'll email Laura and let her know, I'll sign you up for the Loop group for the caregiver support. And then we'll go from there.
And that'll be in the resource page that I'm going to send you under Loop Ohio. I've put in a little disclaimer. I've put in a little click here to email Laura to be added to the group. You'll just click that link and it'll pop up with my email address, and the subject will be add me to the Loop Ohio, and then I will forward it on to Tom. Or you can just email me straight out from there. But it's all going to be on this on this resource page. It's going to be a lot longer, but I think that's terrific. I love, there's so much information and all this.
One last thing, Laura,
Wonderful.
when you get your notices from Loop, Ohio, that there's a conversation, it happens at 5 o'clock in the morning. Don't think that I am up sending out these notices at 5 o'clock every morning. That just is an automatic system. So when you see that, although maybe I should just say I'm working.
I'm not up at 5 a.m. and if I am, it's because I can't sleep, which happens. But I'm not usually checking my email at 5 a.m. Thank you. Well, are there any other questions? This has been phenomenal, you guys. I am panelists, we so appreciate you. This has been fantastic. Thank you for everybody that's been helping moderate this very active chat and Q&A and who's been here today. This is wonderful. We will get these resources back out to you. This has been recorded and I will do a little editing on this recording and then I'll just get it sent out. It will be posted to Ohio Agribility's Facebook page, but you'll be able to just go in and watch the video there and you can share it. Please share. We hope you do.
Yeah, thanks, Laura. And I think I wanted to get to your kind of something you threw out there a while ago about when do you think you need respite? Just to kind of round off the conversation and then maybe some like parting words and some advice. If you feel like it's too much to handle and you are at your breaking point, you're probably ready for a respite. And, you know, even if you feel like you can manage it and you have a high threshold for stress and chaos, that's not always healthy, you know? And it can be different, you know? I know often we, you know, at least for my age group, again, being a millennial, I saw my friends getting married and having children and they were having milestones of their own, you know, and often sharing their, some of their stressors related to potty training and eating solid foods. But I had similar, you know, parallel experiences with my father, which at some points was much like caring for a child, you know, but in reverse, whereas children become more independent, you know, the elderly become more dependent, you know, so, but it's not real, it's kind of stigmatized. It's not normal to talk about elder care. You know, we should, again, create that community of care within ourselves, normalize caregiving, normalize talking about it. I know everyone always gives the mask analogy, and I understand you need to put on your oxygen mask before you put someone else's, but oftentimes that's not feasible. So someone, I think it was Amy in the chat box, said something about she's caring for her mom who is the caregiver. And I just love that because it's so important, you know? So even if you're not a direct caregiver, think about going beyond the anecdotal advice of like, oh, make sure you take care of yourself, you know, because that's so often easier said than done. And, you know, I would have loved to take care of myself and sit in a bubble bath and paint my nails. But honestly, as soon as I got my dad to bed, within, you know, a minute of laying down, I was asleep, you know, because I was so exhausted from just the stressor. So again, like, you are caring for a caregiver, think of those things you could do, whether it's dropping off groceries, sitting with the, their loved one just for like an hour while they get away. If you're a family member and someone in your family is caring for someone, say, hey, pick one weekend a month that you can just get off the grid, whether it's going to a cabin in the woods or whatever, just disappearing for a while and let me take care of things, you know. Sometimes it's just being really intentional and giving that tangible hands-on help rather than anecdotal advice about reminding them to take care of themselves, because often that's easier said than done. So again, just, and then my kind of parting words are, you know, find your support network, set your boundaries, whether it's with your friends, family, work sometimes, you know, don't bite off more than you can chew, and find those 15 minutes of freedom, even if you can't get formal respite. You know, whether that's early in the morning, take some time to drink your coffee in, you know, the dim light and, you know, meditate, or late at night, you do some breathing exercises. Sometimes just those 15 minutes of freedom can work wonders.
Thank you, Karima. And remember, everybody, you're doing a great job. You're doing a great job at caregiving. It's incredibly hard. It's really hard. It's been a couple of years since I was caregiver with my dad, but man, it's hard to do. And You're doing a great job. So just remember that. Even if they're angry with you, they don't mean it. You're doing a wonderful job. Everybody is. Yeah, so thank you, Karima, Whitney, Nate, Tom, Lisa, Laura, Jody, everybody. Thank you. This has been great. We will be doing this again in a couple months. Everybody that's on here, my planning committee is saying we are. Yes, we are. We are doing this in a couple of months. I have everyone's email, so I will be sending the recordings out to you, and then you will get the notice for the next webinar that'll probably be in maybe by May or early June. So again, we are going to send out a survey. Please take the survey. That's how we know what we want to talk about next time, what you want to hear about next time. It's very helpful, and it's really helpful for us to hear how we do. So thanks, everybody. Thank you, Lisa, for grabbing all the chats and Q&As. All right. Thanks, everybody. Have a great one. Enjoy the snow, and daffodils will be up soon. That's what I've heard anyway. All right. Bye. Thank you for joining us today for sharing respite experiences and resources. Where do I start? Presented by the Ohio Caregiver Support Network. Thank you again so much to our panelists, Karima, Whitney, and Nate. You guys are experts. Thank you for all of the information and experiences and resources that you shared. We really appreciate your time and expertise. Handouts and resources for this webinar are available at agrability.osu.edu. That's spelled agrability.osu.edu/caregiver-support-network. Thanks a lot. I hope you come back to another one of our webinars.